This is David, who came from Sweden to be treated here at the Hesch Institute in Aurora, Colorado, and I wanted him to share his experience.
Yes, that's correct. I've been here now for 3 days, and I've received treatment for. I came here because I've for many years had discomfort in my lower back and on my left side, and I have a slight curvature, side bending that's been diagnosed as scoliosis, but it's very mild. But still, I had quite a lot of discomfort. And over the course of the years, I've sought treatment from lots of different practitioners. I've tried structural integration, which did help to some extent, but and also treatments specifically to address the scoliosis. But after all that, I still had symptoms, and I was not comfortable. And I sort of felt that there was. I've always noticed since I was a teenager, and I'm 20 years of age now, that there's been my hips have been unleveled, or they've not been equal in height, and so one practitioner that I was seeing in Sweden, he had taken Jerry's basic course and started to treat me with his method, and I thought that this was very interesting, so I asked him where this work that he was doing, where he picked it up, and that led me to contact Jerry and ask him directly what his thoughts were, and this led to me feeling that there was probably more potential in this to be explored. So I decided to come visit him here in Colorado. And now, after being treated for 3 times, I can say that I'm very glad that I did come here. He did suspect from the start, based on what I told him and the x-rays that I sent, that there probably was some developmental asymmetry. And there was a possibility that that because of the asymmetry, this was simply something that we could not change. And there was also the possibility that there was changeable. And what we found was that I did have a number of things, even things that I myself was not aware of, in my foot on my left side and in my knee on my right side, where I had restrictions or laxity or hypermobility, I guess. And so that was very interesting, that there was these things that I myself had no idea about, that were quite obvious right away to Jerry, and we were able to correct these things. So now they move normally like they should, and also there were restrictions in movement in my hips and pelvis that we were able to address, and we achieved correction in terms of function, where the joints in my middle and lower body now move like they're supposed to, which they weren't previously to come here. And also, even up in my neck, there was also some maladaptation or restriction that I was also not aware of, but we were able to address that as well. And after we worked on this, we saw that there was still some asymmetry present, and that is my sort of default mode, that there are developmental asymmetries which we address with heel lift and adaptations to how I'm sitting. So I will use something to prop my left side, where my ilium is a bit shorter than on my right side. And now after seeing Jerry, at least for the duration of the the days that I've been here, I've felt good, and I've had a reduction, quite significant reduction in my symptoms. And what I'm hoping is that this will be maintained. And Jerry's taught me exercises and things that I can do myself to maintain these corrections over time. So I'm very optimistic at this point, as in terms of what I will be able to achieve through this treatment that Jerry has provided. So I think I'll stop here. And
Very good. Thank you very much for your summary. I sure appreciate it.
Thank you.
And I have a great respect for you flying all the way from Sweden to come out here to Aurora, Colorado.
Well, this has been a main priority in my life because the symptoms would take up too much of my attention and distract me too much from what I really want to do and reduce my quality of life. So I've been very determined for quite some time to really get to the bottom of it and do everything that's possible. And I should take the opportunity to say this as well while you're still recording, that what I came here and what you told me was that what you can really offer, the thing you can promise me is that you will tell me exactly as it is, and I will know. I won't have to spend more time worrying or thinking about, is this something that I can work with, or is this something I'm going to have to accept? And now I know that there is this component that is that is there, and it is because of how my body is shaped. But also, and I'm very happy to have found this out, that there was this, at least as I perceive it, quite major component that was a maladaptation, and we were able to address this. And just knowing, I feel like for the first time I know what the situation really is in terms of this, and that's a big relief to finally have this confirmation of what the situation is, and also having received tools that I can use to keep it as good as it can be in my case. So I'm very happy about that, and I'm pleased that I came here.
Thank you so much for your thoughts.
Thank you.